Good evening, everyone. Good evening, everyone. We'd like to call the Community Mental Health Meeting to order. I'll begin with reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next is adoption of the agenda. Is there
Support.
Motion by Phillips, support by O'Connell. Any discussion on the agenda? All in favor signify by saying aye.
Aye.
Opposed? We have adopted the agenda. So we will go to the next item, and that's the hearing of the public. Is there anyone from the public that would like to address this board? Anyone from the public? Last call. Seeing none, we will move on to the minutes of the regular meeting of the board that was held on October 23 of 2019. A motion to approve is in order.
So moved.
Motion by Burke, support by O'Connell.
Support.
Any discussion on the minutes? All in favor signify by saying aye.
Aye.
Opposed? Minutes are approved. Next are the approval of standing committee meeting minutes. The first one is minutes of the Program and Budget Committee that was held on November 13 of 2019.
Move to approve.
Support.
Motion by Kraft, support by Bush. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is minutes of the Policy and Legislative Affairs Committee held on November 1. That are sitting before you. Motion by Sierra Matera.
Support.
Support by Bush. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? All the minutes have been approved. Next is item number 7, which is a request for approval. And items A through H have all been approved at the program and budget meeting that we held earlier in the month. And those meetings, all those issues have been discussed and vetted.
Move to, go ahead. Move to approve item A, number 7, items A through H.
Support.
Motion by Bush, supported by Kraft to approve items 7A through H. Any discussion? Nick?
Yeah, there was just one outstanding question on item F on spousal impoverishment, and I had some email correspondence. Oh, there she is. I didn't see her there. I had some email correspondence with the department on that, and I just wanted to give her a chance to give us that report.
Great, thank you for bringing that to our attention. Go ahead.
The answer is no. The policy does not include that. The research that I had done and looked as if it had been possibly only related to the C waivers, and then with the varying laws of the extensions, that I think it's been extended through end of December, as we're trying to move those C waivers. So I need to do a little bit more research in terms of what it's going to look like, but we should add something to the policy.
So would it be appropriate for us to hold off until you get that done?
We certainly can. What I'm thinking, but I don't think it's necessary because the other policy in place, the Chapter 7 policy, needs to also be revised. And as I was looking at the 7 versus the 10, I'm like, why don't we just get rid of this 10 and only have the 7 and put this change there? So I don't think that anything on this, I think you can go ahead and feel free to pass this. And then we just can revise Chapter 7 and Chapter 6 to include it, because we have to update.
Yeah, well, Madam Chair,
It's
I'd
up to
move to
you.
separate.
Yeah, I was going to do that even if you did not make, so for right now, if you could just hold on that, just stay there. We will approve items A, B, C, D. Oops, I just hit the wrong thing. What's the one we're separating?
F.
F. All right, so we're all A through H except for item F. Okay, so any further discussion on any of those? Okay, all in favor signify by saying aye.
Aye.
Opposed? Okay, so all those items passed. Now let's go back to item F. Nick?
Madam Chair, it would be I think she just gave us a lot of good reasons that we may be combining the two, we need to change it, we have to make sure we comply with the mental health code, not just on spousal impoverishment, but on the financial liability rules
That's all set. The
and,
only
yeah,
thing would be the impoverished.
and everything else, that there's some additional research that needs to be done, and I don't think we're quite there. And I think the issue of ability to pay is so important. I'm really uncomfortable adopting an interim policy that's going to change anyway. So to allow the agency to continue to do its work and come back with a completed proposal, I'd move that we table to the next board meeting, or how would you want?
Why don't we hold on to that a minute?
Okay, I'll hold on.
And does anyone else have any comments, or did you want to address that?
My comment is related. I had asked the question about what policies should come up to the full board. And we do actually have an existing policy in place, which I'll bring forward at our December meetings. A lot of it says that board policies and recipient rights policies have to come to the full board. The other operational ones would be signed at my level. So I wanted the board to review that again. It's at your discretion on what you want to see and how you want to see it. But that's my only comment. Other than this, we will be, reviewing everything on the annual basis and providing updates. And then it's just what you want to see after that.
All right, so if this were either postponed, tabled, whatever, would that cause harm anywhere? Is there something time sensitive about this issue?
No.
Okay,
So
go ahead if you
I'm
want.
trying to figure out what the easiest motion, because I would kind of like to see this and the others all in context, and David makes a good point, I think, if we're going to review what we're going to review.
Well, we could just send it back for further,
send it back to
for
program?
further work, yeah, or send
Okay,
it back
Okay, I move to refer to program and budget.
and then they can, and we won't even say what date, whatever time you need to.
That'll be up to the chair
Yeah.
as to when he'll put it on the agenda again, and I assume the chair will confer with the CEO to determine when we've got the information we need to act.
Okay. Is there support for that?
Support.
All right, motion by Seer Matero, support by Burke. All in favor signify by saying aye.
Aye.
Opposed? All right, so it was sent back. Next is item number 8, receiving file. I don't see any documents for that. And item number 9 is a resolution. I'm sorry. Item number 9, resolution for Arlene Ames. She's a certified peer support specialist, and she is retiring due to, may I say?
Yeah, she's very open.
Yeah, she's due to illness, yeah, health issues, yes.
That's too bad.
Motion to approve, Bush by Bush, support by Burke. All right, any discussion?
I
Yes.
just want to thank Lori Doyle for taking this on and bringing this to our attention. Thank you. Did you write it too?
Yes, I did.
Good. Thank you. Thanks, Lori.
Thank you.
All right. Seeing no one else, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. And next is item number 10, paying of the bills. All right. Motion by O'Connell, support by Phillips. Oh, did you say? Okay.
Bill Phillips, what's his name? A rock star.
All right, any discussion on any of the bills or vouchers? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is the management report.
Wow. When I was trying to put some remarks together, there was so much information. It's hard to whittle it down, but I did provide an update to the board, and then we had our legislative committee this morning, and then more than a few of the board members stayed for the Citizens Advisory Council as well, where more updates were provided. So based on that, I wanted to go back to the email from Sarah Esty. She's at the Michigan Department of Health and Human Services. Officially, she's the Senior Deputy Director, Policy and Planning. She'd offered to follow up with me either by phone or by person. If there's any feedback that this body would like me to share at that meeting, or if you'd like to be part of that, I do need to contact her back, and I plan to do that by the end of the day tomorrow to start the scheduling process. Other than that, some internal updates. I will be issuing our own internal kind of restructuring, tweaking. It's a follow-up to the 100-day report that I shared with the board. It's intended to make us more in alignment with the standard practices with the other healthcare agencies around us and that we'll be interacting with. So some of our departments will have new titles, some of the directors have new titles. Along with that will be a roles and responsibility, their primary roles and responsibilities for each department, which will help people direct their questions or concerns appropriately. I will share it with our providers. It'll be on our new updated website, and all of the staff will get it as well. Along with that, we have a new Chief Compliance Officer starting next week, Stacy Coleman, and she'll be starting on the 26th. We also had Chief Clinical Officer. That position was filled by Dr. Agnes Ward. Agnes is a PhD psychologist. And Crystal is in the audience. I may have overlooked her once, but I needed to correct myself on that. When Sheila Cote left us, we had to fill that position, which is Director of Community Behavioral Health Services. So Crystal Buizi, did I get it right, is our new director in that. And when we made that announcement, the staff, a lot of people hit reply all and had very nice things to say about Crystal. So we're happy to have her in that position. And I think that's the staff updates, hopefully for a moment here, until other people start to retire and such. Randy. We got to get our digs in between now and January, folks. So I'm calling that phase 2 of the kind of my plan. Phase 3 is looking at physical space. We had a number of departments like Cindy's and quality that added staff, and we just need to make sure Cindy has enough physical space. So we're looking at that next. The handout I gave you for the holiday celebration, I'm learning that that's an annual event. I missed it last year, and you are all invited, and it's 12/12 at 12, so it should be easy to remember. And like I said, I will bring forth our policy on policies to the committee and to the full board next month. And with that, I'll just wish everybody a happy Thanksgiving.
Very good. Thank you. Linda.
I just have one thing, it's small print on announcement about the Christmas party, and it was explained at the CAC. They're doing a donation drive for the homeless, and you can bring socks, food, gas, gift cards in $5 or $10 increments for a homeless family will be collected. And they'll give you a ticket for a raffle for some very nice prizes that they say they have. So to remember to support the homeless at the holidays is a good idea. I applaud the staff for thinking of doing that at their holiday party.
Thank you. Next is other agenda items. Do any of the board members have any items they'd like to bring up?
Kathy.
Chris?
At the end of the year, our CEO's contract's up, so we will need to work on negotiating a new contract with him. We're in the process of gathering information. I did have a conversation, Kathy and I did have a conversation with Dave, and there'll be more information coming. We'll have to organize a personnel committee meeting, of course, once we get all the information together. So I'll try to figure out when the best time that will be, but it'd be nice to get that in before our final board meeting for the year. I think Dave would appreciate that too.
Right.
It'd be very nice if we did.
Maybe.
All right, anyone else? Okay, the next is hearing of the public. Is there anyone that would like to address this body?
Hi everyone, how are you?
Hi.
Good evening. In the midst of us switching over to a new brand, I brought some presents for you, so I will hand those out in just a second.
Thank you. Oh, I love it. Thanks. I love the blue. It's like the lake.
Thanks. No problem, thank you.
Oh, I love my pin, too. This is great promotional stuff.
Oh, all right, thank you.
And there's a nice little poke thing on the inside.
Ooh,
If you notice, I'm modeling it.
well, I did see that, yes.
Oh, and you know I love the community.
I was gonna bring them at the next leadership.
I'm glad I didn't buy that big expensive
No, we have,
mug today at the store I was at.
no. Had to remember where that came from, no.
Not me, I'm not that organized. I don't pretend.
Cool, thank
Love the
you.
pin.
You just,
Thank you, gentlemen. So if you look inside, you'll find my card in case you ever need to contact me, because I don't think I've actually had the opportunity to pass those out. And additionally, you'll find lapel pins for you to wear to represent Macomb County Community Mental Health. So I hope you enjoy and like. There's more coming behind that, but this is a great start, and we just wanted to show our appreciation and make sure that you had some tchotchke to represent Macomb.
great. Thank you, Cynthia. Is there anyone else from the public that would like to address this board? Anyone else?
We see you, Sean.
Good evening, everyone. I'm Sean McGregor. I'm with the CEO. I'm just here to give a monthly report. Before I read off too, I also have a copy of my report for everybody. Just want to start off with CEO's mission statement. We believe that all people are entitled to respect, dignity, independence, community integration, and the opportunity to make choices in their own future. For our individual served update, CEO will be hosting a traditional Thanksgiving dinner free of charge for all of our people served. The Clinton Township program and Mount Clemens program will be donated and served by the Order of Alhambra. We will be offering a Project Thanksgiving gratitude jar for those wishing to participate. The individuals will write down what they are thankful for the day of our free Thanksgiving dinner, and we can read that out loud, which it's going into basically this craft here. For our individual served monthly educational seminar was on lifting techniques and safety, which you can also find behind my report. For our community center update, our Clinton Township location had a fundraiser for ghoulish grams leading up to Halloween, which made $294. That will be used for Christmas. Our kitchen basket raffle raised $212 that will be used to send a large group of individuals to the Detroit Outdoor Adventure Center. We had a new individual also start attending Clinton. At our Anchorville and Mount Clemens location, both held Spirit Weeks for Halloween, which included a CEO Day, Crazy Hair Day, Wacky Clothes Day, and a Sport Day. The individuals and staff all participated and made Halloween a lot of fun. At Anchorville, we also held a donut and cider harvest celebration and a community outing at the movies. For our Washington location, the entire building attended a Joe Dunham's field house. 72% of the individuals served participated in this community event, and this was made possible by a donation from the Knights of Columbus. The micro business Cloud Design sold over $50 in merchandise at the vendor show. We updated and painted Classroom 7 at the location as well, and they will be hosting their annual fundraiser dinner with Santa on Friday, December 6th, which is at the back of the packet. For our stakeholder update, CEO is preparing for CARF. CARF is Commission of Accreditation for Rehabilitation Facilities. They will be arriving on December 4th in Clinton Township location for the entrance conference beginning at 8:30 a.m. And we'll be interviewing individuals, employees, stakeholders, as well as conducting inspections of all of our programs throughout the day and following days as well. The CARF team will meet on Friday, December 6th at 1 p.m. for the exit summary meeting. We would like to invite anyone on the board to attend these meetings as well, which I've branched out to a few of you, and I appreciate that for getting back with me. And that's just a very important day for CEO as well. CEO's employee retention rate for October was 97%. And then finally, CEO and myself would like to extend a warm and happy Thanksgiving to everybody here.
Thank you, Sean. Is there anyone else from the public?
Good evening. Bruce Stunton from Crossroads Clubhouse, Director. On an annual basis, I like to try to provide the board with an update of some of the quality indicators that we track on an annual basis at the clubhouse. The quality indicators are actually mirrored for Clubhouse Profile Questionnaire, which we're required to complete and submit to Clubhouse International on an annual basis. When we first started tracking CPQs, the Clubhouse Profile Questionnaires, a couple years ago, it literally took about 3.5 hours to collect all the data over several days. One of the things that we started several years ago was each one of the units collecting data on a weekly and a monthly basis so that we can summarize that data much quicker and it won't take so long to do the Clubhouse Profile Questionnaires. So I thought that I would just provide a summary of our activities for this fiscal year, 2018-2019. Our average daily attendance was 30 people per day with unduplicated sign-ins of 71 individuals coming in a month. That equates to over 6,000 times people are walking through the doors at Clubhouse. Total meals provided, 4,968. throughout the course of the fiscal year, and we celebrated 13 holidays, even the silly Valentine holidays as well. One of the things that's kind of unique about what we do at the clubhouse is we celebrate holidays on the actual holidays. So there's usually a unit leader, including myself, there at the clubhouse, opening the doors for whoever would like to come and spend a couple hours with us. For Christmas Day, I'll be there making breakfast. So if anybody would like to come have breakfast with me, you are more than welcome to come and spend that morning with me. We have an average of 414 meals a month that we provide, and that includes 2 meals a day. So it's usually breakfast, which is oatmeal and fresh fruit, and then a homemade lunch. It's not a can of soup that you open up and heat up and call that homemade. That's not homemade. We had 11 member orientations, which is new members that come to Clubhouse, and 52 tours that we did for last fiscal year. We started tracking hospitalizations last year. We only had 3 people for the whole fiscal year lost to psychiatric hospitalizations at Clubhouse. We only lost 2 people to physical hospitalizations for the fiscal year last year at Clubhouse. We do an outreach, a community outreach on a regular basis. So people whom we haven't seen at Clubhouse, haven't been attending on a regular basis, we reach out to those folks, and we did 758 of those for last fiscal year. We send out 461 newsletters on a monthly basis, and we have 224 people that are following us through social media. We have 3 people in our housing program right now. They've been there for about 7 months now and have been doing very well. Clubhouse International expects that we have at least 20% of our average daily attendance participating in what's called transitional employment. Transitional employment allows people an opportunity to work in the community for 6 to 9 months. We are at 26%, so we're exceeding that expectation by Clubhouse International. The amount of time that we've spent supporting our transitional employment members has been 394 hours for the entire fiscal year. We also have a supported employment program that we also support as well. We have 11% of our average daily attendance participating in supported employment, and we supported those folks for 27 hours for the entire fiscal year. We started a wellness program this year. You have 3 opportunities to participate in wellness. You can either do a wellness walk with me, that's a 1.5-mile walk every day after lunch, or you can do what's called chair yoga for our population of folks that have a little more difficult time walking, or you can go to the gym. We have a membership at Planet Fitness. We've had 65% of our membership participating in our wellness program at 87 hours for the entire year. Social rec activities, we provided 86 social rec activities. Every other Saturday, Clubhouse is open to do social rec activities. And so we've provided 86 of those, and the average monthly attendance for that has been 32 people. We've billed for 121,000 units for the last fiscal year, and we've transported people to and from Clubhouse for a total of 8,235 miles. So we've had some great success there at the Clubhouse, and just looking at the trends from the previous fiscal years, we continue to get just a little bit better and a little bit better. Crossroads Clubhouse also participates in the Clubhouse Deductible Grant that's exclusive to clubhouses. There's 6 PIHPs in the state of Michigan that are participating in it this past fiscal year. In our first quarter, we had 5 people participate for a total of $3,000. In the second quarter, we had 8 people participate for $10,400. In the third quarter, we had 9 people participate for $18,400. And for the fourth quarter, we've had 11 people participate for a total of $22,200 for a grand total of $54,066 in support that we've provided to the Medicaid spend down folks. So that is our summary of quality indicators for Clubhouse for 2018-2019.
Thank you.
Thank you.
Anyone else from the public?
Hi, I'm Lori Doyle, the Peer Support Coordinator, and I'm happy to say that we have somebody here to share their story, Ray Dewhurst, and he is a member at Crossroads Clubhouse.
Good evening, Mr. Pankatine, Mr. Genove, and the board. My name is Ray Dewhurst. I started attending Crossroads about 5 years ago and had to leave because of spend down. And I now have been reattending effective November 1st for exactly a year. And I have really gotten into it this time. Before, I'll be honest with you, it was just a place to go and a place to get my spend down met. Now, 3 years after that, and now a year into it now, I have been very active in the clubhouse. I don't know if Bruce mentioned it or not, but we're pursuing a 501c3 Friends of Crossroads Clubhouse Foundation, and I am the member at large and acting secretary for that. I'm also part of the 501c3 board for Clubhouse Michigan, and I consider myself to be a leader within the clubhouse. I'm always helping people out, always a shoulder to cry on or laugh with or whatever may be necessary. And that's just what I'm doing for the clubhouse. What the clubhouse has done for me is in the year before I went back to Clubhouse, I was hospitalized about 10-15 times. In the past year, I was hospitalized twice. One of those times was only as a precautionary measure. The other time was just some minor trauma, nothing major. Where before, I was getting suicidal ideations, I was getting homicidal ideation sometimes even, and I was emotionally out of control. I caused destruction in my house. It was just terrible. And in the year I've been back, I've had almost zero self-injury episodes. I have only been hospitalized twice, like I said, and my family says I'm a lot easier to get along with. I go 4 days a week, and those 4 days are sacred to me. They're the best 4 days of my week, and I'd like to really thank Mr. Bruce Dunton here for providing such a wonderful clubhouse to all of us. And I would also like to thank the administration, Mr. Pankatine, Mr. Genove, and the board for allowing such an entity to exist within the county. Thank you.
Thank you.
Thank you for your story. Thank you so much. Anybody else from the public wishing to speak? Thank you all for your updates tonight. Seeing no other speakers, we will close the hearing of the public, and I'll take a motion to adjourn. Motion from Megan, support from Nick. All in favor? Aye. We are adjourned. Everybody have a good Thanksgiving.